panelists, when you speak, if you could do us a favor and just tell us a little bit upfront about the type of community you are. Just again, we're trying to make sure we covered a few different types of senior living communities in Loudoun County. So just so we have a good understanding of the type and level of services that you guys provide, that'd be great.
Another housekeeping question. I've tried to play with the settings here a little bit. You shouldn't be hearing people as they enter the room. Are you guys hearing a chime when people enter?
No.
Good. Okay. So I just set that so that only the host can hear that, so that I don't miss people as they're coming. People are continuing to come on in, so we'll just be mindful of that, and I'll be letting them in here as they come. All right. Got to share the right screen here, Nancy. So feel free to get started while I bring this up.
Sure. Okay. So I'm Nancy Nicholson, and I'm an adult nurse practitioner. I've been a nurse practitioner since 2012 with a background in home health, hospice, and nursing homes. I am now an employee of Heritage Hall. I have previously worked for a couple of different physicians in the communities. So here at Heritage Hall, it is a skilled nursing facility with 165 beds. And we take both skilled and long-term care residents. We are in the heart of Leesburg. The building has been open since, I believe, the 70s. And so it's been certainly a challenge through the past 8 months on what we have endured with the COVID. So starting with, I don't know if everybody can see my slide. So starting with pre-COVID, we all went into isolation. One of the benefits of Heritage Hall is we are 1 story, and all of our residents have a window to the outside. We have a few rooms that go into a courtyard, but otherwise families were able to make window visits, which was a huge boost for the residents. We also have iPads that we did FaceTime, where a variety of people would do FaceTime visits with those residents as well, in addition to phone calls. We also have an outside visitation booth that was built sometime, I believe, around June. And we can do visits there with families with a plexiglass partition in between. And we also had some individual activities that, in small groups with the appropriate 6-foot distancing. Post-COVID outbreak, we continue to do all of those things. In addition to the fact that with the cold weather, we've now built an inside visitation booth for families. And now that CMS has directed us, we are starting to do some small group dining and small group activities. I think we have 25 residents that are going to our main dining room, 6 feet apart. And then we have, I believe, about 18 residents going to a restorative dining room. So that has really been a huge help for the residents, but also the stress on the staff. As we know, the workload on staff has been horrendous through all of this. And we're also starting to do some small group activities. So Derek, I don't know if you can move that across. I'm on slide 3. So as we all know, testing is what has saved us all. We tried to test as soon as possible with fever and cough. Those were the herald signs that we were looking for. Initially, we were doing PCR testing, which unfortunately takes 2 to 5 days to get results. We now have the capacity and the capability of doing antigen testing, and we get our results in 15 minutes. Anyone that tests positive on an antigen, it is sent out for PCR testing to validate those results. So the big thing is that with an outbreak, and unfortunately we've had 2, and once we get all of those results, then we take a floor plan and we determine where all the residents are who have tested positive, and we create what's called a hot unit. Excuse me. So the hot unit is anyone with a positive COVID test. A warm unit is someone with a negative test who has been exposed, such as a roommate, or has been out to an office, a doctor's visit, are out in the community. And then the cold unit or cool unit is a negative test and no exposure to COVID. So that meant at times moving multiple residents from where they had been to other places so that we could keep everyone safe. And we also had designated staff to work in the hot and warm units to help prevent further spread. One word of advice is keeping a timeline and keeping track of all the dates, all the residents, you know, who got sick, who recovered, who died, and just CMS and the surveyors just want those notes, and those numbers are very hard sometimes to keep track of. So family notifications throughout all of this, we had a group of staff. We have an administrator in training. Next slide, please, Derek. Administrator in training, along with our social workers and admissions office, that they would call families and update on what was going on within the building, so that they were always up to date of any outbreaks. And as the outbreaks cleared, they were also notified that things were back to normal. Any positive resident would be notified by myself and the director of nursing, so that those families could be told what was going on, how we were going to isolate, how we were going to treat. And we would also talk about what was happening, you know, if they were to decline, and talk to them about goals of care at that point as well. Any positive resident would go into quarantine and isolation for a total of 28 days. So that's, so a treatment, anybody that was positive or a high suspicion of positive was started on a Z-Pak, vitamin C, vitamin D, and aspirin. We would start oxygen if their oxygen saturations were less than 92%. And we have the capability of going up to 10 liters of oxygen. Anyone that was having air hunger, we found that Ativan was very helpful as a muscle relaxant. It would help them breathe a little more easily. And I recently met with our pulmonary consultant, Dr. Swami, and he suggests that anyone on oxygen, we will now also start on steroids. One of our biggest challenges was the weight loss and the lack of appetite. A lot of the residents were extremely fatigued. And what we found was that we put people on liquid diets. It takes a lot of energy to chew. We were throwing away a lot of food. Staff were getting very frustrated because they couldn't get folks to eat. So what we found was that was very helpful was a liquid diet or a liquefied pureed diet. We also here have a feeding program. It's an 8-hour program that our educator provides to teach non-nursing personnel to help with feeding. So we had folks from the admissions office, the social workers, our unit clerks, were all trained to help with feeding. We also would also provide IV fluids. And again, we would do the liquid diets and the IV fluids for as long as we needed to. We only sent 2 residents to the hospital during this time. One needed a much higher level of oxygen, and the other one, the family just felt very strongly that they wanted her in the hospital, and she did return to us. They actually both returned to us. We also, during this time, a lot of people would have setbacks, so we would check for secondary infections. Our UTIs had gone up significantly, but we found that a lot of our UTIs, those residents were also COVID positive. So we do a lot of in-house testing and get folks started on medications as soon as possible to help prevent decline. We also checked for pneumonia. Oftentimes didn't do chest x-rays because we didn't want to bring extra people into the building. But we would start them on antibiotics, oxygen, Ativan, and Roxanol if needed to help get them through that. So end of life, we had a lot of discussions in terms of end of life considerations, and that was usually done by myself or the doctor, but mostly myself, in a discussion of family goals and advanced care planning. Some of these discussions would take place when, as soon as we notified families that there was a positive COVID, that, you know, a lot of folks do not survive it. So it was a matter of getting DNR, DNTs, funeral homes, and getting comfort medications in place right away. So it's been a journey. We learn a little bit more each time. Hopefully there won't be a third. We've gotten smarter. And at this point, we're testing all staff on a weekly basis, even though we don't need to do it quite that often. It makes all of us feel more confident that we're keeping COVID out of the building. So unfortunately, I'm being paged for an emergency, so I'm going to run. And I will be back once I check and see what's going on. So again, thank you. I hope that was helpful. And if you have any questions, my contact information is on the next slide.
Thank you very much, Nancy. We really appreciate you being here. Hope that goes well. Join if you can. We will go to the next panelist. All right. So with that, Waltonwood, looks like you unmuted.
Hello, can you hear us?
We can.
Okay, awesome. Well, good morning, everyone. And so my name is Kathleen Kasaya, and I'm Tiffany Ashton. We're both the marketing managers here at Waltonwood Ashburn. Thank you so much for the opportunity for us to speak with everyone today. Waltonwood offers independent living, assisted living, and memory care here in Ashburn.
Okay, so we'll get started. Communication was definitely the key to adapting to our new normal here at Waltonwood Ashburn. At the department head level, we talked things through, exchanged ideas, and formulated courses of action. Next, we presented our ideas to our team members, soliciting their thoughts and ideas for the way forward and incorporating their input. Finally, we communicated with the residents and the families, gathering further input. We planned virtual meetings, prior to which we asked for everyone to submit questions so we could address those questions during the meeting. Then we took further questions at the end. This new practice strengthened the communication, which has made us closer as a community. We continue these virtual meetings every single week. These lines of communication generated many ideas to keep our residents safely engaged and ensured we were meeting their social and physical needs. For example, we instituted an at-your-door service where we could provide groceries and other essential items to our residents so they would not need to leave the community. Kathleen and I delivered baskets. One type of basket we did was a cleaning basket with cleaning products to our independent residents. And our thought was that we could check in with the residents and also provide some products we thought that they might need. Our life enrichment team created a door-to-door activities cart. We did Seeing of the Seas, a cruise to Jamaica. We celebrated Nats opening day, and we held happy hours, dance parties, hallway bingo, and trivia. We held social distancing graduation for our team members who graduated high school and college. We held live cooking demonstrations, delivering ingredients to our residents who wanted to cook along in their apartments. Other activities were courtyard musicals and mobile hot coffee and ice cream sundae bars. We also implemented virtual and window visits for residents and families.
A couple of other things that we implemented as far as the safety measures, we trained our staff on COVID-19 prevention measures. We also participated in train the trainer classes so we could learn how to properly fit the KN95 masks. And we limited our tours to virtual tours. Then we gradually phased in-person tours. We are limiting those visits to 2 guests, and of course, socially distancing and temperature checks and wearing a mask at all times during the visits. And we conduct 100% temperature checks on all of our staff, our residents and our family members entering the community, as well as guests coming into the dining room for their meals. We follow guidance as well as others, of course, from the governor of Virginia, the county health department, and our leadership here at the community to determine when to bring back communal dining and the life enrichment programs. As of today, our efforts have allowed us to bring back full dining service in the dining room for the entire community, our life enrichment programs, and our transportation. Precautionary measures in place, such as social distancing and wearing masks. We continue to exceed expectations of our families and residents, and we really encourage all that to call Tiffany and myself. If you're looking for a loved one, if you're looking for a client, to learn more about Waltonwood and to schedule an in-person tour or virtual, we're still doing those too. And that concludes our presentation.
Awesome, ladies. Thank you so much.
Thank you.
We will now pass the torch over to Justin Roberts. Good morning, Justin.
Good morning, everybody. How are you doing? Can you hear me okay?
Yeah, loud and clear.
Yep, you're good.
We were having some internet issues earlier, so hopefully I can make a 5-minute presentation without cutting in and out. But thank you guys very much for giving me the opportunity. My name is Justin Roberts. I'm the administrator of Landsdowne Heights Memory Care, located just about a quarter mile from Inova Loudoun Hospital. For those of you that aren't aware, we did open this summer offering memory care services to people with a cognitive impairment from early stage all the way up through end of life. So it's interesting hearing everybody talk about their different experiences, definitely taking some notes about, some things that we could be doing a little bit differently. So this is a great opportunity, I think, for all of us to learn from each other and share some best practices. But COVID-19, I think, hit all of us across the face, and really, I don't know if anybody was really prepared for, the aftermath and what the long-term effects were going to be. But for us here at Landsdowne, I think it affected us a little bit differently. Originally, we were looking at trying to open up in middle of April, right when I think everything started to really shut down. And we decided to delay a little bit. Took about a 6-week delay to really focus on some policies, procedures, making sure that we had the proper PPEs and supplies for our staff to be safe and residents to be safe. And then education, to be honest with you, training for our team were really our high priorities for us prior to opening up. Our goal for here at Landsdowne is to really be those trendsetters in all of those areas that I just mentioned. And that little bit delay really was important for us to make sure that we got things right when we opened up the community, early June it was. So right after we opened, really shortly after, we pivoted pretty quickly in offering in-person visits outdoors and tours to the public, really right off the bat. The outdoor visits, for those of you that have heard me speak before and talking about isolation and the effects that it has on seniors and depression, and especially with somebody with a cognitive impairment, is important for not only our residents here, but for those family members that have trusted us to move their loved ones into the community, to really get that face-to-face time that's not virtual, that they can actually sit across the table and be able to see their loved one, even if it was for a short period of time. So that was important for us to be able to do that. And then on the other side, for the sales, we're still in healthcare. We're still selling a home. And there's a high percentage of people out there that, although it's great to be able to do those virtual tours, to see the pictures, but still need to be able to see that touch and have that feel. So for us to be able to have some long-term success branding and opening up a community during this time, it was important for us to be able to try to figure out a way to offer in-person live visits as soon as possible. So we did that really by working with our local health department, our corporate team, and then our medical director, Dr. Pellegari, and looking at different portions of our community that we could have safe entry and exit, and really limit and minimize any type of risk of exposure that our residents are getting from any type of external visitors. If you haven't had a chance and opportunity to come see the community, it's a unique setup, which I think for us unknowingly, we have the ability to, we have a front lobby that is transformed into our visitation, where family members can come and they're separated from the rest of our residents inside of the community. So that gives us that unique touch there, as now that we are offering indoor visits. But in addition to that, we actually have a whole side of our community that we were able to shut down a little bit and offer those in-person tours so that our potential residents could come in and out of the community pretty quickly, see our models, get an idea of what the inside of the community is, and then sit down with Sandra, our sales manager, and finish up that discovery process once they're inside of the community. So what are we doing now? And after some of those quick changes and being able to do some visits and having people come inside of the community, right now we are offering in-person tours, indoor visits for our family members, as well as I mentioned, for short spurts of time. We are allowing professionals inside of the community. That's from home health to hospice to salon and spa services inside of the community. And we are also testing staff still twice a month. I really made the decision to have more of a stopgap. I know that, you can test positive, negative one day and a couple of days later, but for us to be able to have a good understanding and make some adjustments pretty quickly, it was important for us to continue that twice a month testing of all of our team members here inside of the building. Sounds like just like everybody else, we're following some CDC guidelines. We're screening visitors through our touchless screening system at our front desk, so that we get a great baseline of anybody coming in inside of the community. And then as for our residents, it's a different world. We're dealing with all memory care, and the positive thing about dealing with all memory care is that it's that redirection, it's that new interaction every single time you have it. And some great stories is we talk about a little bit what's going on in the news, and you say to a resident, it's COVID-19, we need, why is everybody wearing a mask and things like that. You quickly see a resident, oh, should I be wearing a mask too? And we're helping them put their masks on so that they're safe throughout the day. I will say it's a challenge, especially in memory care, to try to continue to have a resident wear a mask all day long. But it is important that, they're involved in the process as well. We're offering still in-person, or I should say, communal dining, socially distanced in that area as well. But with us having the luxury of 2 separate dining rooms and the large size dining rooms, we have the ability to really space some residents out so that they're safe and sound. Finally, we are educating staff. At this point, and I think it's for a lot of our communities out here, it's, we've all done a really excellent job. We've seen the list that goes out every week from the health department, which is, it's like the naughty list that you sit on, like, oh man, I'm on this list. But, I think a lot of that list consists of our team members. And for us, it's been extremely important to educate our staff and team members to making responsible decisions when they're outside of the community. Is it really that important to go to that 40-person family reunion this weekend when we know that we have the frailest of the frail population that we have to take care of every single day at work. And I think we've done I'm super proud of my team here for being able to make those decisions and figure out, what's right, what's wrong. If they're not feeling well, not coming into work and taking care of themselves. Because even prior to COVID, I think as healthcare professionals, we've really struggled with that. You're sick, maybe got a cough, still come to work, but now it's a huge emphasis on, it's take that PTO, take care of yourself, and come back when you're ready. And we've been able to handle that. So takeaway for us, for anybody that's ever been a part of sort of crisis management, which this is really what it is. It's crisis management. We're dealing with a epidemic, and any type of crisis management is, when you get knocked down, what you do to get back up really defines you as a building, as a community, as a person. And what we are doing and what we've learned is transparency is key for our success in our healthcare setting. Listening to what our family members want, giving them the information that they're asking for with no hesitation is important for us to be able to build that trust with not only our family members, but for our potential residents that are going to be moving inside of the community. So I personally, along with our director of personal care, reach out to our family members multiple times a week, giving them updates, not only on their loved ones, because they're not here every single day. They need that. And that's been able to build that trust and lasting trust that we've been able to have here inside of the community. I think it speaks volumes to where we're at as a community. Our reviews and testimonials that we're getting about what we're doing here are just through the roof, and that's our real takeaway from COVID-19. And moving forward, we can't stop now. Now that we're offering it, we're doing it. It's something that I think that's just part of our DNA, and we're gonna be able to continue to be able to offer those types of updates on a daily basis. So thank you guys again for letting me ramble for a little bit and get the opportunity to talk a little bit more about Landsdowne Heights. I look forward to seeing anybody come inside of the community. Reach out to Sandra. I know everybody knows who she is, so reach out to her, schedule a tour. Love to partner with you in any way possible.
Great, Justin. That was going to be what I would ask of all of the presenters, is how do they engage with you if they have potential residents for you, clients who are interested. How do they kind of navigate that? So you kind of answered that question. If you could put Sandra's contact information, Justin, in the box as well. I didn't have that to share, but you are taking tours for new residents. Is that correct?
That is correct.
Okay.
We're also moving in people, so
okay.
All the above.
Wonderful. And Tiffany, Kathleen, do you have any thoughts on if someone has someone who's interested in checking out Waltonwood?
Yes, absolutely. We'll put our information in the chat box. Absolutely, we are welcoming new residents. We are offering in-person tours. Of course, they are limited to 2 people, and going through all of the guidelines with wearing a mask and temperature checks and the social distancing. So absolutely, we are welcoming new residents and move-ins. Okay, great. And I think I would ask Heather, but I don't believe Heather or Nancy are there. Is anyone from Heritage Hall still on the line? I don't think so. I actually don't know the answer to that question. Peggy, do you know, or does anyone know what Heritage Hall is doing in terms of tours and admissions?
I don't. I apologize. I don't.
Okay. Well, we will make sure that the contact information is in the chat box. I've already done that for Nancy. If someone has Heather Price's email, I'm sure I have it, just not handy.
Here's Nancy. She's coming back.
Oh, great. Hey, Nancy, just in time.
Something always happens, right?
Yeah. Well, we just, we were done with the presentations, and we were just kind of going over each community's, how they're handling new admissions and tours and things of that nature. So if you could tell us a little bit about how Heritage Hall is currently handling that, and if there's anyone who has a potential resident for you, how do we engage?
Sure. Okay. Well, any potential residents will go through admissions, Cindy and Jen. We are taking new admissions from the hospital and from the community. They will go to our warm unit for 2 weeks.
Okay.
To be monitored for fever or any symptoms. They have to come in with a negative COVID test. If anybody has any type of symptoms, we would test them right away just to keep things quiet. So if they're skilled, then they would stay on our heritage wing, either on the warm unit or just outside of that. If they're staying long-term care, after the 2 weeks, they would probably be moved into the regular community. But we are taking admissions. We're trying very hard to get our census back up. When COVID started, we were at about 150, and right now we're about 120. So we are working hard to get our numbers back up.
Sure. Okay, I did put Heather Price's email in the chat box. If you have Cindy's or Jen's, Nancy, if you could share that in the chat box, that would be great.
Yeah.
All right, wonderful. Well, thank you to all of the presenters today. This was very informative and might I say uplifting. It's very encouraging to see, what you guys are doing and how you've not just weathered through this, but really have, maintained a very positive atmosphere. And, it is truly inspiring to see how hard everybody is working for our community's seniors. So thank you. Thank you to all of you. And I want to open it up now to any questions that the group might have. And I'm not sure how to, I guess, Derek, you can call on. I don't know where to look to see if somebody has a question, but Derek, I'll pitch that over to Derek.
Kind of two ways here that we like to do the question and answer format. So feel free to use the chat. Certainly that's there, it's accessible, but since we have panelists here, if you want to turn your camera on and your microphone on, I'd be happy to kind of bring you on as a guest panelist while you ask your questions so everyone can see your beautiful faces.
Okay, so turn your camera off if you don't have a question, turn it on if you do. Is that right?
Yeah, yep.
Okay.
Or if you don't want to come on camera, just drop it in chat.
Okay. Okay, Sandra, do you have a question?
Sandra Clune, do you have a question?
No, sorry, I was actually helping Nancy out, and I put Cindy Johnson's information in the chat box.
Great.
She is very, very, she's awesome to work with. I know she's helped me out a lot here in transitioning residents from AL to long-term care.
And vice versa.
Yeah.
Yeah.
So I just put her information in the chat box.
Great,
Thanks,
wonderful.
Andy.
You're welcome, Nance.
That kind of alludes to one question that I had, which is, in terms of residents kind of changing levels of care. So if someone is transitioning from, the hospital to say Heritage Hall, and then they're, they actually need to be in a memory care or another type of assisted living. Is that kind of transition happening, and are there any additional challenges with making a transition like that? So I hope some of the panelists have been working together in that way, and maybe someone can kind of share with us a little bit more about how those transitions are happening.
For those, anyone leaving Heritage Hall, to another level of care, our social workers do a great job of reaching out to the different ALFs or whatever, and then we can, a lot of times it's getting, the TB screening, the COVID done, and we get all of that stuff done so that it's a smooth transition across, as well as signed orders, prescriptions if needed, if they're going home with home health again. It's been pretty seamless to get all of those things done.
I had a question for you, Heather, about your visiting box, as you would say, or there's something that you guys had. How did you make that? How did you do that? What is that?
Sure.
you
Okay,
explain
so
a
I'm
little more about
Nancy. Heather's name is under under me, but it's actually Nancy.
that? Sorry, Nancy.
That's okay. That's all right. So our corporate sent a kit, and it's a square box with a plexiglass and plywood partition down the middle. So the resident would be on one side and the family on the other, and then it had a canopy top. So we've done a similar thing in the dining room, only it's partitioned off just for privacy. And so there are two tables. There's no partition in between, but it is partitioned off so that anyone coming in for the indoor visit, it's right beside the door to the dining room to the parking lot, so they don't have to come through the facility. They're screened. We have a greeter that will be starting shortly, and that will be their sole responsibility is to do visits. The only thing is we do not do the visits during mealtime, because right now we are open for lunch and dinner in the dining room. But it's just I can probably the outside one is being dismantled because of the cold weather, and actually the canopy blew off with the storm the other night. But it's just a matter of providing privacy. The screening, they're checked for where they've been. They have to wear a mask, and they have to stay 6 feet apart. So it's usually a 20-minute visit, and then there's a disinfection done to the area before and afterwards.
So you're going to keep this up during the holidays in your area?
Yep.
Thank you.
And so, and we can't be everything to everybody. So this really does help. People need those face contacts. We did find that when we did the outside visitation booth with folks on our memory care unit, it didn't always go well. It was very hard for them to process that. So we are careful, and we do screen how we do all of that. And we do let families in at end of life. We can move residents to a room that we try to minimize people walking through the hallways and exposing anybody. So we do have a space that we use if we need to, so that family members aren't being exposed to other residents. I'm trying to keep everybody safe.
Nancy, thank you. I think Catherine Fetter had a question.
Yes, Catherine Fetterman with Art Together. Prior to the pandemic, I was doing one-on-one and small group art programs for people with and without dementia and other physical or mental impairments. And could you just give me a realistic idea of the direction I should consider going with my skills and my love for the people? I don't know if I should be trying to look at opportunities now to be in community residences with something that I offered before, or if I have to look at a completely new way to, or if I have to wait a whole year, or I'm just looking for guidance. I've been investing in technology and am developing programs, and I guess I'm just looking for some advice from all of you in the field on what I need to look at as what's going to be reasonable for me to move forward with trying to make a difference in the lives of people in our community. Thank you for your time and your feedback.
Great. I don't think that was addressed. Oh, sorry.
Okay. I think each facility is going to determine who they're going to let in because of exposure. So, but I would guess that with your skills, you could certainly do something with FaceTime for a small group of residents. Elementary schools are doing, virtual learning experiences, and I would think you could use the same type of technology to do that.
Tiffany or Kathleen, do you guys have any other thoughts?
My understanding was staff were really busy, and so that might not be a good route since it would involve staff time. So I was just curious. That's the route I had started to go.
Okay.
We agree that maybe a virtual platform.
Yeah.
Because right now we just have to be so careful, and we can't let anyone in, and we don't know how long that will be.
Thank
I mean,
you.
we've been doing Bible study and we've been doing other virtual things. So that might be the opportunity. I'm agreeing with Nancy and Tiffany.
Can I ask a question to kind of elaborate on that? You know, are the activities directors in these various communities looking to connect with, you know, outside providers, you know, such as Catherine, to kind of collaborate and find better ways to engage the residents?
This is Sami from Great Falls. I can connect her with my team here because we will definitely be able to do virtual, and they can actually host, attend with her at the same time and helping a resident to be engaged. We can definitely do that. We've done it, and we will be glad to, whoever is willing to do virtual, to plan something for them.